Today, I am excited because we have our core sponsors, Weltrio, with us. We have the co-founders, and I'm pretty excited to have Billy and Rhonda with us. We're going to dive in and get to know them a little bit more, find out how Weltrio came about, and so much more. So let's dig in. Rhonda, Billy, how are you guys doing today?
Doing great, Cody. Thanks. Thanks
Doing
for having
great.
Awesome.
us.
Awesome. Well,
Excited
it's
to be
great to have you guys on. Always a pleasure talking with you. And so I know those that are going to be tuning in will be interested to hear what you guys have to say. A plethora of information and a lot of data behind what you guys are doing. But first and foremost, let's just Rhonda, if you want to go first, we'll let ladies go first. How about that? Why don't you just kind of tell us a little bit about who Rhonda is and your background, your experience, and what brought you here today.
I'd love to. Thanks, Cody. So for years of my life, been a stay-at-home mom. I have five kids, and then I inherited five more about 10 years or 5 years ago. But my passion has always been underneath all of that, nutrition and health. Just always interested in kind of the idea of food as medicine. So I worked my way through school, got my nursing license, bachelor's degree in nursing, and then master's degree in nutrition. And I found myself in as a surgical nurse, and I love surgical nursing. Uh, but I found it was really frustrating and even heart wrenching when someone would come in. We did a lot of amputations where I worked, and amputations are often a result of diabetes. So people would come in and they are there for, they're having another toe amputated or even a foot amputated. And when we would do the intake, their blood sugars would be way too high, 600, 700, and their blood pressure would be too high. And so we couldn't do surgery. We'd have to send them into the ER, try to get them stabilized so they could come back another day and have this foot removed for consequences of the disease, which is still not under control. And I knew that if we had caught that in their 20s, 30s, with a little bit of education, even in their 40s, we could have reversed that and not had those awful consequences as a result. So I had an opportunity about 10 years ago, and Billy can tell the other part of this story, but there was a company just going to go under because of the rising cost of healthcare. And in kind of a Hail Mary, I said, hey, let's see if maybe I can help address some of the root cause and see if we can help the population get better. And then maybe healthcare costs will come down and you won't, there won't be they won't have to close their doors. And it worked really well. We had incredible success.
Amazing.
Just and it was really about meeting people where they were. At 10 years ago, a wellness program would come in and it would say, okay, there are five things we measure: blood pressure, blood sugar, cholesterol, weight, and do you smoke? And if you met this range that was considered healthy, you would be rewarded. And if you didn't, you were not. And it was, it felt so random. They come in they have to have a cholesterol less than 200. Their cholesterol is 210. They don't qualify. And they're like, well, what does that even mean? Or
Right.
let's say they have to have a BMI of less than 30 and their BMI is 50. They're not even going to try. So I knew that if we came in and said, okay, what is going on with each individual and where are you stuck and how can we help you find movement so that you don't feel stuck and you can walk your way out of this situation you find yourself in, health improved dramatically. It was really rewarding. But
Sounds
Billy,
amazing.
Billy was a big part of that story, so I'll let him tell.
Yeah, let's hear what Billy yeah, let's Billy, welcome. Uh yeah, let's hear your background and what brought you to this point as well.
Thanks, Cody. Hey, I love how Rhonda said, yeah, it was some company was going to go under. It was my freaking company. My company was going under. So, hey, first half of my career, I was primarily had a little military stint in the beginning, and then high tech. Second part of my career, second 10 years or so, I actually was in military adjacent activities around a government contractor, a federal contractor. The name of the company is Cayuse Holdings. You can go look it up if you want. It's still a company today. When I took it over, it was about 200 employees. Didn't know much about any of that kind of thing when I first came in, And my HR director came in and said, "Hey, what do you know about medical insurance premiums?" And I said, "I know I pay it every month. I know that there's some type of wellness program where if I like fill out a survey, I get like $100 off." And she said, "Well, that's mostly right, but what you don't know is that we have a 25% increase." And I said, "Well, surely the previous CEO budgeted for that." "Well, no, sir, he didn't budget for that, and now we're in some trouble." So I talked to my finance people, and they were right. I mean, we were we were seriously screwed. So I called United Healthcare and said, "Hey, look, we're a small company trying to serve the government. I mean, we're doing the right thing. You're killing us here. What's going on?" And they said, "Sir, we've got this utilization rate. Do you know what that is?" I'm like, "No, no idea." Well, basically, that means for every dollar that you pay in, we pay out. How am I saying this right? So for every dollar that we pay out, we want you to pay in enough money to where we make about a 20% margin. And I was like, "Okay, well, surely we're doing that." "Nope, your utilization is 168. So every dollar we pay in, they paid out a buck 68. "Oh yeah, that kind of sucks. That doesn't work long term." And they said, "If it wasn't for the Affordable Care Act and the state of Oregon laws that exist here where you are, actually we would dump you as a client because you're not going to be profitable for us, and we're going to raise you 25% every year until you finally are profitable." So being a brash CEO, I said, "Well, fine, then I'm going to take my business elsewhere." And they said, "Sir, we would love to have you take your business elsewhere. We're losing money. The only reason we haven't dumped you again is because the state of Oregon won't let us." So I went
Wow.
home and I talked to Rhonda and I said, "Wow, career mulligan time. This was not a good move. I think I'm going to go do something else. I don't want to write this company down." But it's a shame because this is such a good company, and I really want to help the people. I just don't know what to do. Talked to some of my CEO buddies. They said it is just a tax. You just pay it. You have no control over it. Rhonda said, "Well, I don't know that I agree with that. What's the problem?" Talked to the HR director and some of the employees and realized that none of them had a primary care physician. They all were using the ER for everything. And, it's what a lot of busy people do. You just going to see a doctor is 2 or 3 weeks out. And if your daughter at 3 in the morning has an earache, that doesn't help.
Right.
So, long story short, she came in and said, let me work on it a little bit." I called United Healthcare and said, "Hey, we've got this nurse who's going to come in one day a week. Will you lower our rates a little bit?" And they said, "We won't lower them, but we won't raise them 25%. We'll raise them a little bit less than that so that you can stay in business." The next year, Rhonda comes in with my HR director. I've got 200 employees. We're barely scraping by. "Hey, I'm going to take you self-insured." Like, that is crazy. We can't go self-insured. That's ridiculous. Only big companies can do that. Like,
Right.
nope, I got it. We can take you self-insured. Smaller companies do this. We just need to watch it and be careful, and I will set this up. So 10 years later, my company is now 120 million top line, 750 employees, a lot of DoD work, DOS work, spec ops teams. I mean, the whole thing, Afghanistan, Ukraine, lots of stuff we're doing, and boring things like requisitioning toilet paper for embassies in Saudi Arabia. I mean, just boring stuff as well. So we're at the point where we're big, or bigger anyway. Congress determines exactly how much we pay our people. So if I have a competitor, I know exactly how much they're paying their people because that's exactly how much I can pay mine. So the only way I can differentiate, retain employees, and recruit new ones is on strength of benefits.
Hmm.
So we are retaining everyone, recruiting everyone. I mean, we're having no problem at all. I had a recruiter call me up and say, "You need to talk to this contracting officer." And so I talked to this contracting officer, the people we get business from, and he said, "Hey, my guys have talked to your guys. I don't know how you're doing it, but your benefits are so much better than ours. Will you please come bid on our contract?" Sure, absolutely. How many more contracting officers are there that will do that? It really helped my business development. So 10 years later, I look at our numbers. I know because it's public, everybody our size, they're paying between 12 and 13 million a year in medical insurance premiums. Includes TRICARE, I mean, all of the military type things. Very standard, everybody's doing it. You know how much it cost us? $3.5 million.
Oh,
That was
wow.
it.
That's
That was
nuts.
it. It was
That's crazy.
crazy. I couldn't even believe it. I had to talk to our CFO and like, are you sure? Are there no other hidden costs anywhere? Over time, Rhonda and her team got our costs down slowly over time, built up some version of an HSA kind of thing that we were investing our money into, and such a huge competitive advantage.
Mm.
So, at the end of 10 years, decide, hey, I think I'm going to go do something else. And Rhonda says, look, this is fun. I'm really a medical provider, not so much a business person. I think maybe, I'm gonna end doing this for your company and for a couple other companies. And I said, Rhonda, what you got is so needed. I mean, I've been with CEOs before now where they've seen the brokers come in and they're like, oh, sorry, you got a 25% increase. Sorry, you got a 45% increase. And there's nothing they can do. And they just feel awful because their company's going under. There's nothing they can do about it. Rhonda, you
Yeah,
can't stop this. You've got to turn this into a company. You've got to grow. You've got to help these people. The healthcare system is just killing small and medium-sized businesses. And
right.
this is the solution. This is a solution.
Well, that definitely sounds like a great big idea. And I think that other businesses are being a serial entrepreneur, owning multiple businesses myself. I've been at the other end of getting that email around this time of the year from my broker saying, "Hey, congratulations, you just went up 25% on your insurance premium." And as a small business owner, it puts that lump in your throat that makes it hard to swallow when you see that. And you're just like, okay, I guess this is what we got to do in order to be a business, right? And you just
It's
kind
a
of
tax. You just got to suck it up, right?
yeah, it's kind of that way. But so for anybody that's not hasn't been really paying attention, that is an amazing origin story of what Weltrio is and has come to be. So for those that are not really familiar with what Weltrio is and actually does, they kind of got a hint of it. Who wants to take a stab at that and really tell us what issues, what challenges, what services or products do you guys offer and focus on to help businesses? And are there certain sizes or specific ones that you're looking for? I think that's the next question that a lot of the listeners would probably have.
Let me take a shot at it just from a business standpoint. You'll see over time, I know next to nothing about medicine. This is really all Rhonda. My only superpower is in business. I'm reasonably successful at what I do, but how she does it is still to me kind of a black box, a little bit of magic. But I do want to say this. So initially, I didn't understand what this was. What she explained to me was, Billy, when you get to a certain point in your career, you make enough money, you need to have a tax accountant. If you try to do it on your own, you're reasonably, successful and smart and so on, but you don't study this and read these behemoth manuals that come out every year. Find a tax accountant and they will optimize your taxes and save you money. Or you can just pay like everybody else does. And she was absolutely right. I mean, that is exactly what Weltrio does. Rhonda is your healthcare tax accountant for your business. So what she
Nice.
does is really three things, and well, it's super complex, lots of stuff, but three general areas. First one is that your broker likely comes in and says, "Hey, do you want plan A, B, or C?" And as the CEO, you're like, HR director, what do you think? And the HR director is like, B. And you just kind of choose one. Sometimes it's more in depth than that. I don't mean to insult anybody, but for the most part, you don't realize that there are hundreds of thousands of plans available. Your broker doesn't want to bring you all of that for obvious reasons. They want to make money on what they're doing. They bring you a few options. You choose one. It doesn't fit everything, but it fits enough. So the very first thing that we do is Rhonda and her team will come in and look at your plan, look at your people, look at what your business strategy is, and pick a plan out of the hundreds of thousands that actually is more optimized for your people. If you're a small company, that often can save your bacon because there are so many things that you can do, massive differences in how much they cost. And she can make just a massive difference if you're under 50 employees.
Hmm.
If you're over 50, you have requirements to do different things.
Mhm.
Typically what she'll tell you, and she'll talk here in a moment, you really need to be self-insured because if you're self-insured, you can create your own plan that's
Hmm.
specifically for your own people. But in between that 50 and the time when you decide to go self-insured, there are also multiple things that she and her team can do. So that's the very first thing we do is we look at your benefits, we curate them, and we optimize them. Thing number one. That's uno of the trio. So
Gotcha.
dos number two is there are a lot of logistics. So if you think about medical care right sizing, I mean, you're
Hmm.
going to an ER or you go into an urgent care or you go into a primary care physician, you probably gone to all three. It just kind of depends on the time of day or night or the emergency. So there are lots of things you can do with that. Pharma sourcing. If you're using a pharmacy benefit manager, likely you're paying a lot of money for your pharmaceuticals. If you use a transparent PBM, it's better. But Rhonda's been able to find sourcing through Mexico and through Canada and any number of things that just save a ton of money just in the logistics. So
Hmm.
by logistics, I mean you need healthcare, you want it delivered. There's a way to get that done. It's super expensive. She focuses on the logistics to bring the cost down. The third thing, and this is the final one in the trio, there's a lot of focus today on AI
Hmm.
and self-help. Let me give my employees as little as possible and have them help themselves as much as they can just to reduce cost. I totally don't blame CEOs for doing that. I did the exact same thing, right? I ran a small call center as part of what I did. The second we could get AI in there, I had AI handle as much as we could simply because it's cost effective. You
Right.
have to do that to save your business. So it's counterintuitive to spend a lot of time with an employee. You want to spend as little as possible. What Rhonda's found, though, is that if you spend enough time with the employee, you build trust. You build trust, you can get in front of spend. If you can get in front of spend and change the behavior, you can bring utilization down. If you bring utilization down, you bring cost down. So the three things in the trio in Weltrio, the first thing is benefit curation. Second thing is optimizing logistics. The third thing is she has a team of coaches that are board certified and nurses that all have degrees and providers when needed that interact directly with your employees at minimum on a quarterly basis in order to help you get to where you need to be as an employee, to get the right health care, to make sure that the insurance company is not calling you or vice versa, that you're taking care of that, basically handling all of that stuff. Now you'd think, oh my goodness, that's got to be expensive. It is. I mean, it costs money to do that. But there's so much waste in the healthcare system right now that what we've been able to do is get in, work directly with the employees, bring those costs down. And we actually don't charge typically for what we do. We take a percentage of savings. And the
Hmm.
savings is so great that usually after a year or two of doing that, employees say, hey, can we just pay a per employee per month fee? Because this is, I mean, you're saving us a lot of money.
Right.
So again, my company, 12, 13 million, we had better benefits down to 3.5 million consistently over 10 years. I know that she can do this.
Oh, that sounds amazing. That's amazing. So let's dive, Rhonda. This question is more towards you. Let's kind of talk about some of those unique things that you are doing. Billy kind of mentioned a few of them, but what are the things that you do to, from what I'm gathering, it sounds like you guys are kind of more or less healthcare risk management with the employer and the employee. And you guys are taking more of a proactive approach. Is that correct? And if so, what are some of those things that you could give us as examples of how you're achieving this?
So it's complex. There are a lot of things we do, but primarily we're getting with the employee. Um, Ideally, the first time we interact with the employees during some kind of open enrollment, we actually do an in-person or Zoom call open enrollment. We take our time, we get to know what the needs are of the individual and their family. We help them understand their benefits and even get excited about them, and then establish Weltrio as their number one call for any questions they have related to benefits, how to use benefits, what providers to use, where to go for, if you need additional specialty services, pharmacy sourcing, this prescription was super expensive. What do I do? Where can I get it for less? So we're very high touch, in person, establishing ourselves as the go-to, so that you're not the questions on, where can I find a good primary care provider aren't going to HR, but to a team who's specialized in helping people find the primary care provider that's perfect for their family and cost efficient. Um, in that meeting, we also are going to talk about health objectives, things that the individual that we're meeting with wants to do to improve their personal health, a goal that they have been thinking about and are maybe ready to tackle. And we're going to help them break that down into bite-sized pieces so they can do that, accomplish their goals over time. And really identifying that the current healthcare system prioritizes treatment over prevention, and we really want to prioritize prevention over treatment. Although we never prevent treatment, like we pair perfectly with the current medical system. People need care, and they need affordable care, and they need access to it. And we're going to help them find that, but we can do it for valuing those healthcare dollars and spending them wisely. That's important. So
Yeah.
we're not saying, oh, you have to peel carrots and cut apples and run a mile a day in order to be well. No, we're going to find out exactly where you are and what you and your family can do to improve your quality of life. And then we're going to help you find the care you need to get you to where you need to be, all along the way, working on prevention and improving your quality of life. We really want to attach a lot of value to every dollar that you spend. Right
Uh-huh.
now, dollars kind of are spent without even, insurance is so interesting. If you have a high deductible, you might be interested in how the dollars are spent. But if you have a copay and you go to the pharmacy, you pay your $10 copay for a drug, you may not know that that drug costs $10,000. So Weltrio absolutely will get in front of.
Sorry, did you say
Oh
$10,000?
yes, even there's a hepatitis C drug uh, that's over $30,000,
Oh
and
my
but they have
goodness.
prescription drug programs that just seem like, oh, that's fantastic. You only have to pay $10, which is true. Most specialty drugs have a prescription club that you can join and get it for less, but you can only qualify for the club if you have a, a private insurance.
Oh my
And what
goodness.
the pharmaceutical company does is they will pay your maximum out of pocket. Let's say you have a $10,000 maximum out of pocket. The manufacturer of the drug will come in and pay that, charge you $10. Now your max out of pocket is met for the entire year. So next month they're going to charge you another 30,000 for that drug, and your company is going to pay the full amount every month. And you're just going to be like, well, I just paid $10. I don't know what you're talking about. So I absolutely get in front of those as Weltrio and help. That same drug I know how to get for $3,000. And so I will get in front of that drug so that we aren't spending $30,000 on a drug that we can spend 3,000 on.
Sorry to
So
break in. I like to watch football. So during the Super Bowl, I yell at the refs. During the commercials, Rhonda yells at the commercials.
Oh, that's awesome.
Anytime one of those like Wegovy and so on comes on, she's like, "Do you know how much those cost?" It's
Oh
really
my
kind of funny.
goodness. That
it's
is
so
hilarious. Yeah,
so
no,
frustrating.
I totally get that. I mean, I've been on a medication here for years, and I remember when it first came out, my copay was $400 just for a 30-day supply. And about 2 years ago, I went to Australia for 3 months to work with a client of mine. And the same pill I had to get filled over there, which was a nightmare logistically from a health insurance coverage thing. But I ended up just paying cash, which was $80 out of
Right?
pocket, no insurance, nothing. I was like, for the same pill, same name, same company, same everything, came off the same manufacturer line. It blew my mind. And I mean, I was kind of aware that there was all these different price hikes within, pills and medical procedures and stuff like that. But I think that was just kind of that aha moment that where it all kind of came together for me when I realized that it is more than just the $10 that you're paying for the copay, right? And being a business owner, it's like, okay, that's where a lot of my money's going is just off of this stuff that could be, prevented, right? So,
So,
no,
so
no.
frustrating.
Yeah, it is. It is. Anything else that you guys do on a regular basis to help get in front? I love how you're proactive. You work with us, the employees, on how to do things the right way. So I take it that I'm going to have to give up my Red Bull and my Pop Tarts that I live off of 24/7. Sounds like if I want to live a healthier life without diabetes, it sounds like. But what other kind of things can you help with? Because, to me, it really sounds like you guys are definitely working for the employer and the employees, not necessarily, the insurance company or the brokers. You guys
Right.
do work with them, correct?
Yes, we are not insurance or broker. We work with them.
Perfect, perfect. And so this
So
gives you a lot of flexibility to be that bad cop in the situation of going back to the insurance company and saying, "No, this is what we need. This is how we're going to do it," and kind of laying it out. Is that kind of the vibe I'm getting from it?
there's so many things we can do. The most impact I can have is as a company self-funded. And sometimes self-funded can be scary, but it is a scary thing if you don't have somebody monitoring the back end and making sure that traffic is directed correctly to the most cost-effective approach. If you do nothing to change your plan but do self-funding, you're going to find yourself in the same situation where rates are going up next year. But we can work with anybody, and ultimately we work with them until they're either large enough or financially prepared enough to go self-funded, and we make that process really seamless. Then there's lots of control. You have lots of data. I can definitely insert myself into places to prevent some of the big spend. One of the things I really like to do is tier providers. So let's say you need a knee replacement and you know you need a knee replacement. And let's say you have like a $3,000 deductible. You can go to any doctor you want and pay your $3,000 deductible and get the surgery wherever you want. But if you are willing to work with Weltrio, we can direct you to maybe the provider can work at a different facility. We'll go in prior and purchase and pay cash package price for the whole thing upfront, usually costs a fraction of what the insurance would pay. And then for that inconvenience of having to get Weltrio involved and intervene, we'll waive the deductible. So that saves the individual $3,000. It saves the company tens of thousands of dollars. And you can actually usually get it from the same provider, just a different location for the surgery. We get it all prepaid cash, so you don't have to worry about all the bills that come from all of the sources
Right.
after: facility, anesthesiologist, prescription, doctor, the doctor's assistant. Like, you don't have to worry about all those bills. Just we prepay upfront cash.
So I had an employee come into my office and say, "Hey, thank you so much for waiving my deductible. $5,000 on I he was a diabetic and he had some foot issues." And I was like, "Oh, you're welcome." And then I called Rhonda, my HR director, was like, "What the heck? We paid $5,000 deductible." And my HR director was like, and Rhonda said, "Yeah, because it saved us $60,000 top line." It's like, "Oh, you go right ahead. You do keep doing your thing."
5 grand is definitely better than 60. No,
That's
no,
right.
that's way cool. So so when it comes to introducing this to prospective businesses that you can help, self-funded, fully funded, it sounds like you guys are definitely across the board on who you can help. Uh, but when it comes to actually getting the momentum going, like, what is some of the holdbacks that you guys are experiencing with working with the employees, working with the businesses directly, even working with the brokers or the TPAs, like you were talking about just a second ago? Like, what are some of those hurdles that you're seeing, and what are you doing to kind of evolve and work around those hurdles or objectives that you're getting?
There are definitely hurdles. We would be lying if we said there weren't. People don't like change. Um, if you have a plan and you've been on that, a health insurance plan, and you've been on that plan for years, uh, it's almost easier to pay that 10, 15, 20% increase than tell your employees, hey, we're going to change your plan because the employees are going to be upset, uprooted, have questions. They all go to the HR, and HR is like, I don't want that. Can we just pay the increase? So
Right.
we acknowledge that that is going to happen, which is why we try to put ourselves between HR and the employee so that we are where the questions come. And
Mm.
with a little bit of conversation and a little bit of education, we can ease those fears and help them transition if that's what's needed without
Okay.
with very little upset. There is going to be a backlash. We intend to take the brunt of that wave, and the wave will last less than 3 months, I promise. And then everybody will be settled in and they'll understand how their benefits work better than they did before. They're going to be um, when people understand and begin to trust that we're here and doing what we say we're going to do, a lot of momentum is built. They talk to their friends, their colleagues. They can't believe
Right.
what they did. Just recently, I had an employee come to me and say, "Oh my goodness, my doctor wants to do an MRI. What's going to be my deductible?" And I looked at the plan and I said, "Your deductible is $750 for complex imaging. But I tell you what, when are they going to do it?" He said, "They're going to do it after my appointment, tomorrow." "Okay, are you willing to go to a different location to get the MRI?" "Yeah, whatever I need to do." I said, "Okay, after your appointment, call me before you get your MRI." So he did. He got in, had his appointment. They were ready to do the MRI. He went out to his car and he gave me a call. And I said, "Do you, so I just need to find out what the bill codes are, what they're ordering, and then I can send you to the right place." So he gave me the bill codes. I said, "Okay, here's where you can go. It's about 15 minutes from you. They can take you in the next hour. They'll do the same MRI and send the results to your doctor." So he was super excited. He went in to let the doctor know because it was going to cost him $150 instead of 700.
Wow.
And the receptionist said, "Oh, where are you going?" And he told them, "How much are they charging you?" $150. They said, "Oh, we'll do it for $150." So he was so excited because he got that same, the MRI at the location
Right.
he was for $150 where he would have spent 750. But what a company doesn't realize is that because these charges are being made with no transparency, the insurance card goes in your employee's pocket and it gets pulled out like it's daddy's credit card and swiped just willy nilly. You have no
Yep.
transparency
Yep.
whatsoever.
Yep.
That $750 MRI was not going to be $750. They were going to bill your insurance 3,000. Then they were
Right.
going to give you this fancy discount and only charge you 1,500, of which the employee was going to pay 750 and the employer was going to pay 750 when they would do the same exact thing for 150 cash. So we're definitely going to leverage that. And then the employee is sold. Like, okay, what else can you help me with? And where else can I go to reduce my costs? And can you help me find a pediatrician, or, what provider is the cheapest for, a new baby or whatever the case is? Establishing trust, getting in front of those situations, we can help anybody do it. And ultimately, we want them to think about and move towards and be comfortable with self-funding. Not because I get anything out of it, but because I can really build the plan that's right for them and use the levers within the plan to direct traffic and get that logistics down. Like in
Yeah.
2025, the US spent $5.3 trillion on healthcare. And if we just directed it to a different, just worked on logistics, we could cut that in half easily without compromising any care. Same
Wow.
care, just a different way of delivering it. We could cut that in half.
Yeah, because I think I was reading an article or saw something somewhere that 65% ish roughly is wasted every
Yeah.
year on benefits. That that's amazing to me. So that's definitely in line with what you were just saying. Like by just doing certain things, you could cut that literally in half,
Yeah.
which is interesting. So I'm curious. Every family has one. I'm assuming. Uh, the good old cowboy, I guess you could say, that doesn't want to divulge any information about his health, even to his wife or his kids, wants to literally go out to the barn and duct tape himself back together, then go see a doctor and go through that, let alone calling you or your coaches first to schedule an MRI or a different type of procedure. How do you deal with those good old cowboys?
So let's actually reference back to you, Cody. You talked a little bit about Red Bull and Pop Tarts.
Yep.
First thing I do is I'm not taking anybody's Red Bull or Pop Tarts away. You
Okay.
you do
That's
you.
good to know.
I'm not making you. You can't. You can go to your barn and you can use duct tape if that's what you want to do. Um, I'm not going to intervene or tell you you have to do something or stick a Fitbit on you and say you have to do so many steps. That's just not how my team works. But we are going to start meeting with you quarterly,
Mhm.
and you're going to be incentivized to do that because it will be tied to maybe a contribution to your HSA or to a reduction in your premium. So
Okay.
we use a carrot and stick, and we definitely need to use a little financial incentive to get some of those cowboys to drag their butt into my office and sit down, which I'm not opposed to doing. And then we just have a conversation. Whatever they want to talk about, tell me about the barn and the duct tape. Um, and where there's an opportunity, there will be a little bit of education. Um, I might teach Cody a little bit about why Red Bull maybe isn't the best option, but it's okay. And you know what? Over time, the Red Bulls tend to disappear.
Yep.
And education, like, oh, I didn't know that about sugar and how it works in the body and how much stress it creates in my liver and how it's converted to fat and all. Like, I'll teach you some of those things so that when you do pick up your Red Bull, you go, do I really want to do this? Just I know statistically, just by meeting and talking about health for 20 to 30 minutes once a quarter, your health will improve. Just like if you meet with a financial advisor, 20 to 30 minutes a quarter, your financial situation will improve because then you're thinking about it, at
Yeah.
least occasionally. And I was actually shocked at how much things improved. Even some of those good old boys that I worked with, and there are several, and several other categories of people that are fun to work with. We look, it's 7, 8 years in, and they'd be like, "Oh, I'm still, struggling with XYZ." And like, but think, where were you 10 years ago? And
Yeah.
like, oh yeah, wow, you know, I'm much better off.
Yeah, yeah, I can definitely see that. I can definitely see that. Especially where, a lot of it is built into our DNA.
Yeah.
And a lot of us go and are not mindful. Yeah, we've got our family history. We know of certain things, but really being able to take a look and be proactive at things definitely will make it so that you can live longer, healthier, and enjoy life a little bit more. Let's
Yeah.
kind of pivot this over to Billy. This question's kind of for you since you're kind of more of the tech guy with tech background. There is a lot of data when it comes to healthcare. And obviously, you guys take privacy, data privacy, personal information privacy to its max. I'm curious though, from a data standpoint, how does this really help facilitate happier, healthier employees in the long run?
So this is actually really more of a Rhonda question. She can talk to you about HIPAA compliance and all the certifications, so on. I will say that when I have an employee come into my office and say, "Oh my goodness, my wife last night woke me up. My daughter was screaming with an earache. We didn't know what to do. We didn't know who to call. We're just going to go to the ER." And I remembered, oh, I need to call Monique uh, on Weltrio's team. And then within like 20 minutes, everything was good. Like they were just
Uh,
scared. They didn't understand. I mean,
uh-huh.
that's just really, really cool to do. Um, from a coaching standpoint, all that information is completely confidential, completely private. Weltrio has all of the certifications Rhonda will talk about here just in a moment. But the people are so well trained as to what to do to that with that. And then Rhonda has developed a number of tools that she and her providers use and the coaches use that are AI based in order to really quickly come up with some of the things that need to happen to help people. Again, you can look at YouTube videos, day in and day out and learn some cool things about finance. But one call to somebody that actually lives and breathes that stuff, usually gets a much better answer. And that's how we do things. So
Makes sense.
Rhonda really has had a background that is akin to training your AI on a very specific data set. She's got this amazing data set, but it's not so much the data set that's super valuable, although it absolutely is. It's the prompt. It's
Mm,
what you ask it and how you ask it. Rhonda not only has the data set established, but she also has the ability, and her team to talk to somebody, figure out what's going on, get the right information, match those two up, and then it comes up with something that's super valuable.
Interesting. So, kind of going out on a limb here, would it be if I was buying, using my HSA account to go to CVS or Walgreens and buy Tums and antacids and all that kind of stuff? Are you basically stating that with you guys seeing those claims, seeing that data in my profile, maybe be proactive and say, hey, there might be something bigger going on. How long has this been how long have you been buying these kind of things, that kind of stuff? And it might be related to stress, might be related to something going on in the tummy, might be something else completely. Are those the kind of things that you're taking a proactive approach on as well?
So I'll take that one. Cody, that's a really good question, and absolutely not. We are not looking at that level of data. Um, our coaches are trained to establish a relationship quickly. Um, there's some questions we ask, but nobody has to answer any question they don't want to answer. Uh, HIPAA and the laws around HIPAA and privacy are a priority. Absolutely. I mean, as you can imagine, when the CEO of this company said that his wife was going to come in and do a wellness program with his people, it was not well received.
I
It
bet.
was not well received at all. That was a massive wave that I attacked, but people would come in and I would say, yeah, that is a concern. I would be concerned too. And all I can do is say, I'm going to do what I say I'm going to do and let time tell. And I am not going to risk my license, which I spent years getting because I want to tell somebody about what's in, what you told me yesterday in my office. It's just not worth it. And
Right.
I'm trained and I'm professional and my team is trained, and that's just not how. And we're not going to look at your purchasing at CVS. However, you might find that as you're sitting down with a provider on a regular basis and they're asking questions that maybe came up at our last meeting to follow up, you might go, I have had this issue with stomach acid, and I hundreds of times I've had that conversation with people. And what are some of the things that might be contributing to that? And what are some of the things you could try today and come back in a month and tell me if it's helping or not? Um,
Right.
and that we use those tools, the Tums, the over the counter, the prescriptions, as a crutch to get us where we ultimately want to be, which is not needing those things.
Yeah. No, that makes total sense because I mean you definitely have the good old cowboys that don't like to to do anything. But then also, data privacy is definitely on the top of mind for a lot of people, especially, two things, financially as well as their health. And having those two things in their pocket and being able to have control is amazing. So hearing that you guys definitely treat it the way that you do is in my book the right way to go. Give the end user the right to be able to divulge the information that they want to share with that. So again, it comes back to trust, right? But
Yeah.
from a tech side too, it's all about, having these smart applications, smart data, all this kind of stuff. It's only as good as the communication that it gives to all the other platforms that it integrates with, right? And I look at your coaches as kind of that universal translator of your insurance policy. What can and can you not do? Working with your benefits and all that, even with your providers to help you get the right care, is perfect. So we've kind of
Okay,
talked
so
about.
I'll get
Oh,
techie just for a second. So
oh,
the
good.
challenge between databases is they don't communicate well.
Yep.
And lots of people make lots of money transferring data from one database to another. I actually ran a company briefly where we used some proprietary XML that we created to basically take data from one database and put it into another. Super unwieldy. We lost the context. It was, I mean, it was just super challenging to do, but we made a ton of money because people needed us to do it. And in
Right.
healthcare, especially where you have so many EHRs, electronic health records, they don't follow the consumer around. They're embedded in the hospital or the clinic. And you go from one doctor to another, and sometimes they'll fax things over. What do you even do with that? So it's super challenging. But when you said, hey, her coaches act like a universal translator, that's exactly my experience as well. Now, as a CEO, I knew nothing about what was going on. I can barely spell HSA. Most of the stuff that Rhonda does is really a black box to me.
Yeah.
But I had employees come into my office time after time saying, wow, this is so awesome. Thank you for doing this. And a lot of it is actually translating not between the providers and the employee, it's actually between HR and the employee or the insurance company and the employee. I literally had somebody call me up just ticked off and said, look, you're the only person that I can call because I talked to my manager and they won't listen to me. And I talked to HR and this is private. So I'm calling the freaking CEO and I want you to handle this for me. And they were talking about this claim that they had tried to put in. And I said, look, I don't know anything about that. Well, you're the CEO, the buck stops with you. Like, have you called your coach? Well, no. Okay, here's what you do. You call the coach. If you can't get what you want, you call Rhonda. She owns the company. If you can't get what you want, you call me. Heard from him 3 or 4 weeks later, happened to see him in the break room. Hey, did that? Oh, yeah, they took care of that. That was not a problem. So Rhonda and her team, they absolutely act as universal translators, not only between, the providers and other things, but all of the things around healthcare, occasionally even around like through partners. Like,
Right.
hey, this is Joe. My wife's on the other phone, on the other line. Will you talk to her, Rhonda? Explain to her what the insurance is, because I have no idea. And I personally have never done that, right, Rhonda?
No comment.
No comment.
Fleets the fifth. All right.
Will you please talk to Rhonda because I am lost.
No, no, that definitely I can definitely see that. And especially the part where you're talking about going back to these databases, especially when you go from one doctor, you go to the next doctor, same day, same network, same everything. It's just you still got to fill out the same forms. You got to do things. And, my dad was actually going through this. He had EKGs done in 1 month by two different doctors. And I'm like, why? And one of them was only, no joke, a day apart from each other. And it's like, why can't you just use the EKG results from the previous doctor, have them sent, and do this? And I agree. Like, not only is the healthcare system broken, but that's one of the major pillars that is broken is the lack of communication. So yeah, having universal translators to be able to navigate through all of this is definitely a time saver because I don't know about anybody. Maybe you guys like to, but when I sign up for my insurance, I just know this is my deductible, this is how much I'm paying, and this is my copay. And these are like the top little caveats to my thing, right? I don't really dig into the ditches to see what it actually covers a lot of time until I need a specialist or this or that. That's when I get a little bit more concerned. But and then I have usually have to call up my broker or dig deep into my coverage documentation that I got from my employer. But yeah, no, that's amazing. So, obviously it's just not you two. There's a team behind you guys. We're definitely going to have a lot of them on the Behind the Premium podcast here to give them interviews, just like we're interviewing you guys. But why don't you guys give us a little bit of a teaser of who is on your team and the value that they're bringing to the table for you to help you guys scale and expand your guys' Weltrio program that you got cooking.
Go ahead, Billy.
So I've got a couple partners. When Rhonda said, "Hey, look, I think I don't want to do the business part of this," I'm like, "Oh, honey, you're going to save so many companies." She said, "Great, but you handle the business piece." So I found a couple partners that are absolutely wonderful at this. One of them, his name is Josh Ziglowski. He actually ran ERC specialists, and they've done immensely well, like billions of dollars in sales, working with some smaller companies in order to get them access to government programs. He's a self-made millionaire. He's got real estate and other types of things that he's interested in. Went to talk to him about this, and he said, "Oh yeah, I have totally seen the same problem. Absolutely believe in it. Let's jump in and figure it out." Another one is Jacob Davis. Jacob is to IT what Rhonda is to healthcare. I mean, just absolutely amazing, the types of things that he can come up with. The very first thing that he talked about when we talked about this was not necessarily the healthcare, although he's very passionate about that as well, but instead the data. There's so much data. How do you get access to it in a way that's moral and safe for the individual, and protect it so that they own it, but
Mhm.
move it around so that the providers can see what they need to see. Because every single time I go to another doctor and they've got to fax something, it just drives me bonkers. So he's been working with us to help that piece of it. One of Monique's coaches, or sorry, Rhonda's coaches have been around for a long time. Her name is Monique. Amazing. When I met her the first time, I was like, "You're going to come coach me? What are you, like 14?" But I mean, she is just awesome. I mean, so I've got crusty old, master sergeants that are retired who can hardly help from calling her girl to her face. And then I've got a buddy that I worked with that was a partner at a big, massive company and retired and had this, I don't know, $2,000 or $3,000 a month concierge program to where anything he needed from a medical standpoint. And I would say, "Hey, look, you need to go work with Rhonda." And they're like, "How would I do that? I've got this." You know what they ended up doing? They ended up working with Rhonda because it was so much better than the
Oh, that's
concierge.
cool. That's very
Lots
cool.
of other people that we can probably bring on that have a lot of good industry experience. Super excited to see where this goes. This is such an enormous problem. Everybody knows the healthcare system is broken. Nobody really knows how to fix it. Being able to work from the inside out instead of the outside in, and instead of pouring more money into it to fix it, we actually pull money out of it and use that money to fix it. Genius.
Awesome. No, that's
She
amazing.
she's the genius.
We hire
No idea how she does it.
we have a team of registered nurses, nurse practitioners, and board certified health and wellness coaches. Now, a health and wellness coach board certification hasn't been around for very long, but they have kind of created a program, a standard curriculum with testing and continuing education. You're allowed, to use the CPT bill codes and diagnoses, and it's it's legitimized coaching. I get those as a baseline, so I know what training they've had and their background, and then I train them kind of in the Weltrio way, which is we're going to prioritize prevention over treatment, but we're going to make sure that anybody gets the treatment that they need and all of the things that we talked about. So we have a really specialized team, and the AI comes in really when because we had talked about that and what are we going to use it for.
Right.
Uh, there's words that are triggered that then would just flag a nurse to look into this situation a little bit more and maybe call the employee individually instead of letting it sit out there. And then the nurse can escalate to a practitioner and even to a provider when necessary. So there is some AI in there, but it's more to direct care, not to find what's going, to snoop. It's not used to snoop.
Right. I think one of the things that I loved most when I learned about Trio's coaching aspect of the trio, right, um, was that it's not a call bank of nurses. You actually get assigned a specific nurse that you talk to and coach. And that way, every time you call in, it's not like you're calling all over the world for support, and each person is just trying to hand you off to the next person or whoever, or they have to reference the notes. They're like, this person is actually uh, designed to know the ins and outs of everything that you've provided, everything that's accessible to them. Is that correct?
That is absolutely a dedicated coach and nurse for each employee. Um, and the nurse is 24/7. So, of course, there's not one person that could be on 24/7, but you are calling your nurse. And if for some reason that nurse doesn't answer the call, it's routed to a backup. And then they just, are going to follow up with your nurse. So you are always working with the same person and you're going to talk to a person, not to a. And then when you have those questions, like, was this bill not paid? We will actually call with you because often it's a communication between insurance and provider. And the employee is just stuck in the middle saying, it's not my fault, it's theirs. It's not my fault, it's theirs. And so we will call with you and say, we'll sit on the phone while you now call the provider. And then the provider and insurance talk and it's all better. So we don't do these soft handoffs where we give you a website or an 800 number. We call with you.
That's amazing. So, for those that are interested that are listening to this podcast episode, for those business owners or HR directors or benefit managers, CFOs that are tuning in, if if they're interested in signing up for Weltrio, is this like a kind of towards the fall enrollment time that they usually can sign up for Weltrio, or can they sign up at any time?
So they're going to think about it once a year when they get their broker letter and see what their increase is, but we can plug in at any time during the year. Absolutely can help at any time during the year. And all they just need to go to our website, which is weltrio.com. And there's actually a place where you can get a free assessment where we will look at what you're currently offering. We'll compare it against national averages for your company size and your geographic location and help you know exactly what we think we can save you. And if we can't save you any money, we'll let you know and won't waste any more of your time.
Oh, that's amazing. So, what kind of information do you need to get that assessment from them?
So it's pretty basic and it's all online. You upload the number of employees you have and what you're currently paying and maybe your scheduled benefit and document the SPC. And then we use that to create a really nice assessment so you can really see how you compare to industry averages for um, your demographic, your line of work, and if we can save you money and how much we think we can save you.
Perfect. And how long does the assessment usually take once they upload their documentation? How long does it take them to get the assessment? And how long does it usually take if they're interested in moving forward? How long does it usually take to onboard a traditional sized company, would you say?
So it's not an overnight process. And once they upload the information for the assessment, we can get that turned around usually in about a week, often less, but especially during the open enrollment time, it takes us a little bit. Um, then we do a review of the assessment, and then we send a contract. We do 3 to 5 year contracts, but you can opt out for it without cause at any given year. And then depending on the time of year, we can plug in right away, or we can wait until your open enrollment and do open enrollment with each of your employees, sitting down with them one-on-one to go over their benefits. Even if we plug in like mid-year, we are going to still, if you have one geographic location, we will come there and do onboard each of your employees to what the program is, how their benefits work, help them introduce them to how we plug in and help them with their directing their healthcare,
Mhm.
where to go, best prices for it, for example. So really, any time of the year we can plug in. Probably takes about 30 days from start to finish.
Amazing, amazing. And I think Billy alluded to it earlier, but just to clarify for those that are listening, this is absolutely no risk to you guys. There's no obligation to sign up for the assessment. And even if you do sign up, you don't even start paying until Weltrio saves you money. Is that correct?
Right.
So there's two models. So the first part of what you said, absolutely correct. All assessments are risk-free, no obligation. All the information is protected. Don't charge a penny. someone on our team will get back to you and say, hey, here's what we think we can do, and so on. And then you can decide from there. There are two models to pay. The first one is if you are self-insured or we can take you self-insured, you don't pay anything. We only take a percentage of your savings. What that means is for the first 30 days, 60 days sometimes, we don't make a penny. But over time, we know as those rates come down that we will make more money and that you will save a bunch of money. So not a dime up front in that model. The other model is for very small companies. They're usually not self-insured. They're usually very worried about, I don't know how to provide good enough health insurance for my people. It's super expensive. We offer them a per employee per month fee because they're not typically ready to go self-insured. But even that fee, we guarantee you that we will save you money inclusive of our fee, or we won't charge you.
Amazing. That is amazing. It's a win-win for the business, right?
It is a
So,
win-win. So a small little toy company we worked with, biggest problem they had is, look, we're in a college town. We just can't get people to stay. I mean, they'll work with us for a year, then they'll go get a big boy job, they would call it, that offers better insurance. And we can't keep people. We don't know what to do. So we went and said, well, how much can you spend on insurance? How much do you want to spend? Well, as little as possible. I understand. How much do you think you can do? We can probably do this amount. Sweet. We can totally figure out a way to offer you really good big boy insurance with that
yeah,
type of a model. And what Rhonda had to do is there were several employees that had different needs, pregnancy, chronic sickness, other types of things. She actually had to put a number of things together for this company, but they were super happy with it.
that's amazing. That is amazing. Yeah, I'm pretty excited about it, and I definitely want to dive into a lot of these things that you've been talking about. But I'm trying to be mindful of your guys' time. But looking ahead, let's just kind of look ahead, right? What kind of plans do you and Rhonda have for the future for Weltrio? I mean, for me, when I interview people around businesses, I always like to try to get a little bit of alpha of what they've got cooking on the roadmap that may or may not be public, but they may want to just drop a little bit of a nugget for anybody that's listening in to kind of incentivize them of what's to come because it already sounds amazing. It sounds like it's a great lifesaver. I mean, I wish I knew about you guys 10 years ago when I had a lot of my businesses because it would have been amazing to have you. My pocketbook would have loved to have you guys as well at the end of the day. But yeah, anything you guys want to share that way in terms of plans for the future or any kind of alpha that you want to drop about what might not be coming?
Yeah, let me spill a little bit of alpha or tea, as my kids say. I've got two things, but really, I am not the black box behind this. I am the doofy business guy who tries to make sure that the contracts are in place and gets his stuff done. Rhonda's really the black box. But I will share two things we've got coming up. Number one, everybody understands that the government is shut down right now as we're doing this. Part of the reason that they're shut down is because they're very worried about what's going to happen with the ACA credits. ACA credits are set to expire at the end of this year and go back down to pre-COVID levels.
Hmm.
And I think one party really wants them to stay where they are and grow. The other party says, well, no, let's bring them back down to the levels prior to COVID. I don't know where we'll end up. But Rhonda has been working on that for at least 6 months. What do we do if the credits expand? What do we do if the credits contract? And there are going to be a lot of small companies that are very worried about this because a lot of your employees could get kicked off the plan. So Rhonda's got multiple things in the pot that she's been cooking up that will help with that. The other really interesting thing is a lot of you will have heard of Section 125 plans, cafeteria
Hmm.
plans. If you've talked to your broker probably laughed at you and then told you you're being stupid. Although there are some good reputable plans, and some of you may be even on those plans. The challenge is, in order to qualify with the IRS and the Department of Labor, there needs to be a qualifying event. And a lot of companies are like, well, I sent the employee a text. or I sent them an email, or they, scanned an app or something like that. None of those things have CPT codes attached. So when the
Mm.
IRS finally gets around to looking at those plans, there's going to be a slaughter. And there's going to be a lot of companies going under and potentially liability and other types of things around it. So we've been looking at that, working with multiple companies to try to find the right partner or partners to work with us. And we believe we've got a really interesting plan that's coming out where not only will you be able to pay a lot of the health insurance premium for your employees, but also potentially a 401k for your employees out of
Oh,
the
wow.
same thing by using a cafeteria plan that's set up the right way, using Weltrio coaching and so on, that has all the right, am I saying it right, Rhonda, CPT code
E codes, yeah.
as qualifying events. So as a CEO, that means a couple of my largest costs can now be paid for by pulling down my FICA and basically tax. Government subsidizes me for doing it. It's a program that's been in place for a long time, but it's still the wild, wild west. We're only going to do it when it's bulletproof, and I think we're really close.
Yeah, that makes sense. That makes total sense. And to kind of add on to that, if I remember correctly, anybody that is interested in moving to self-funded, uh, Rhonda, you'll hold their hand through the whole process because I hear that is a logistical nightmare for a lot of companies. And if you don't have the right plan, strategy in place, it could be a logistical nightmare for anybody. But you're going to be their saving grace, right?
Yeah, it's a deterrent. Your HR team and finance team need to sit down and go line by line through thousands of lines to determine if you're going to cover, you know, kidney dialysis this way or this way. And to do that without somebody who understands even the question would be, yeah, insane making. So
Yeah.
I absolutely understand each of the line items and will tell you what I recommend and why and how it should be positioned as far as copays and deductibles so that we're maximizing the benefit but valuing every single dollar that's spent.
No, I love it. I love it. Sorry, did you have any alpha that you want to drop from your side? We heard from Billy. I had to slip in my 2 cents, but or my question, I should say. But do you have any alpha that you would like to drop of what you've got cooking over on your end?
I think that Billy was mentioning what I'm doing, and that is exactly what I'm doing. I've been actively working on what is which what am I going to prepare based on the decisions that come out of the government and making sure that we're covered either way. And then the potential to work with 125 partners who really understand how to legitimize every single claim and create an explanation of benefits to make sure that every dollar is spent wisely and should actually be tax deductible is a priority. And we're finding some partners who are really close.
Oh, I love that. I love that. Okay, one last question. And I want to thank you guys for joining us today on the Behind the Premium podcast. It was an amazing kickoff. We appreciate you guys and definitely looking forward to the sponsorship from you guys as well. And for those that are kind of tuning in, we've got three different types of formats of things that we plan on doing with Behind the Premium. One is exclusive interviews like we've had with Billy and Rhonda today. The other one are roundtable discussions where we're inviting brokers, we're inviting HR directors, benefits managers, CFOs, CEOs, VPs, anybody that has any touch to do with the insurance plans of their company. We're inviting them to join our roundtable discussions as we dive into some pretty deep and tough rabbit hole type discussions, which, in my opinion, needs to be had because a lot of people are just kind of sugarcoating things, saying, this is the way it's going to be. Sorry, best of luck next year. Hopefully, hire more healthy people to balance stuff out, where in reality, that's not the case, right? And then the third one is we are going to be working exclusively with Rhonda to bring you some really interesting and in-depth educational and training videos that you can even share with your own employee base as to how to overcome your addiction to Pop-Tarts and Red Bull in a healthy manner, right? Right, Rhonda? You're going to help me overcome that.
Absolutely.
But anyways, I appreciate you guys tuning in. I appreciate Billy and Rhonda being here as well. So my final question for the two of you guys is if there is one thing that the listeners or the people viewing this podcast today could take away or that you hope they take away from this, listening to this to the very end, what would that be and why? Who wants to
Well,
go first?
I will. I will. I would say you choose your hard is what as the saying goes, and it is not easy to mess with a benefit plan, but the benefits of doing that hard thing initially will pay off in hundreds of thousands of dollars over time. So I would encourage you to choose to do the heavy lifting initially to get to a better place and not have these double digit increases every year on your health insurance policies.
Makes
That's my
sense. It's
that's
like
my
paying off your credit card, right? Get
yes.
the thing paid off so that you're not paying double, triple, quadruple the amount of the balance just by paying the premiums. Get ahead of it, get it paid off. Great, great counsel. Billy, how about you, my friend?
I would say that if you're a CEO or a CFO or a COO or an HR director, don't just take what your broker gives you. Love brokers. They do a wonderful work and an excellent service for us, but don't just take that. Look behind the premium. See what I did there, Cody? Look
I
behind the
like it. I
premium.
like it.
There are so many ways to save money. You know that from all of the other aspects of your business. You never just kind of shut the hood and say, well, I hope it'll work. You always open it up and look inside. And your healthcare premiums are not a tax. There's something that you can do about it. You can absolutely control those.
Awesome. Again, thank you. And thank you to everybody tuning in as well. We appreciate you guys, and we look forward to bringing you much, much more over the next weeks, months, and years. With that being said, thanks everybody. Until next time, keep asking those hard questions because, as Billy just said, it is controllable, it is predictable, and you can control what's behind the premium. So, till next time, have a good one, everybody. We'll catch you later.
Thanks.
Bye bye.
Bye.